Hey, May was National Osteoporosis Awareness Month, which is a time to shed light on a silent disease that's affecting millions of Americans, especially older adults. Osteoporosis weakens bones and increases the risk of fractures. But many people don't even know that they have it until a break occurs. Joining us today is Kelly and Kosma, who is a board-certified nurse practitioner at Hartford HealthCare's Bone and Joint Institute. Kellyanne, thank you so much for being here.
Thanks for having me.
First and foremost, why is osteoporosis a significant health concern, especially for that older population?
Well, osteoporosis is a chronic, often silent disease that occurs as we age, especially because our hormones like estrogen and testosterone decrease. When that happens, that inhibits bone formation. So this is why we see this more in the older population, because especially with women after menopause, estrogen really starts to drop. When bone formation is affected, the bones become weaker, they become brittle, and you have a higher chance of suffering of fragility fracture. And like you said, this is a silent process, so a lot of these patients do not know they have osteoporosis until they suffer that first fracture.
What are some effective ways that people can prevent this bone loss as they age?
So, I mean, obviously living a healthy life, from childhood to adulthood is important, getting optimal nutrition, being active. But as we get older, we want to make sure we're getting the right amount of protein, the right amount of calcium, the right amount of vitamin D in our diets, and with supplementation if need be. Staying active, weight-bearing exercise is very important. A lot of my patients like to walk with weighted vests. They like to do their silver sneaker programs at the gym and do some resistance trainings, things like that. And obviously, not smoking is important, and limiting your alcohol.
And how is Hartford HealthCare raising awareness or providing some support during Osteoporosis Month?
Yeah, so at Hartford HealthCare, the Bone and Joint Institute, we have a dedicated bone health clinic specializing in osteoporosis management and fracture prevention. We're kind of a one-stop shop. We have an on-site DEXA scan so we can screen people for osteoporosis. We have an infusion center so we can provide osteoporosis medications to patients who may need them. We have amazing nutritionists that can help optimize bone health through diet. And then we have strength and conditioning coaches that have formulated programs specific for the osteoporosis population. So these programs are great for someone who hasn't been active in the past or not sure how to get started, or if you've had a fracture and you're afraid, am I going to do too much? Am I going to injure myself again? These are great programs to start.
Yeah, that sounds great. And are there any misconceptions that people may have about osteoporosis and who it affects?
Sure. I think one of the biggest misconceptions is that when patients suffer a fragility fracture, and when I say fragility fracture, it's defined as anyone age 50 or older who has a bone break from standing height or less. So if you step off a curb wrong, if your dog pulls you down when you're walking, if you slip on ice, those are all fragility fractures. Those shouldn't normally happen if you have normal bone health. So in the osteoporosis population, you're more prone to those. But a lot of patients and even some providers don't always link that up that, oh, this is related. So they don't end up getting the appropriate osteoporosis evaluation and treatment.
Oh, wow.
Nationwide, unfortunately, we're only at 10 to 15% of these patients who are actually getting the needed osteoporosis treatment. And we know that if they're not treated, their chance of having another fracture is significantly higher. And we never know if that fracture is going to be the fracture that, changes their independence level, their mobility level, et cetera.
And that's what we want to try and avoid. Kellyanne Kosma, board-certified nurse practitioner, Hartford HealthCare's Bone and Joint Institute. Thank you so much for your time.
Thank you. Appreciate it.
And for more information, you can head to hartfordhospital.org/BJI.